Do you know of someone with depression that is not responding to antidepressants? Many new treatments are available now, including TMS. TMS stands for Transcranial Magnetic Stimulation, and it is an MRI based brain stimulation treatment. About two-thirds of people who have not even responded to medications can get over depression completely or improve significantly with this treatment. If you would like to learn about TMS for depression, you're in the right place. Keep watching. Hello, my name is Dr. Rozina, and I have been helping people with depression for more than 20 years. As an MD psychiatrist, a university professor, and an author of the best selling book, Stress to Joy. I share tips for happy and healthy mind in these videos. If you find value in these programs, remember to like, subscribe, and click the bell button so you can get an alert every time I share a video. My mission is to bring health and happiness to more than 1 million people. So if you think this program can help somebody, please share and participate in the mission of bringing the health and happiness. Today we are talking about TMS for depression, how transcranial magnetic stimulation can help someone stop suffering from depression. So the first question is, why learn about TMS even if you don't have depression? Well, let me tell you two stories. The first one is of a patient who has been struggling with depression for many years, and we have tried all kinds of treatments for him. Because he's not getting better with medication, we recommended that he gets TMS. He learned everything, he got the authorization, but as he was talking to family members, one of them family member who did not understand about the treatment got really scared and scared the patient and prevented him from getting the treatment. And so now the patient is suffering again, and I don't know how long he's going to suffer just because of lack of information about the treatment. Second story is about one of my friends, and she called me, and her 20-year-old daughter is going through depression. And so she said, I've read about TMS. Should we try TMS? And this patient has not tried any medication, any psychotherapy. She hasn't even tried any self-help work or stress management. And so I advised her that that is not the right treatment for her. So we see people on both extremes, some people who are too scared to get the treatment when it is appropriate, and on other people want to get the treatment when it is not right. So therefore, it is very important that we learn about these treatment options. As 20% or more people suffer from depression, you may know someone, a friend, a family member, a coworker who may be going through depression, and you may want to help that person find the best treatment. So learning about this may help you. And you know that untreated depression can lead to a lot of disability and suffering and suicides in some cases. Therefore, it is very important to get the timely treatment. And so my question to you is, do you know of anyone with depression who has not gotten better with medication and psychotherapy? Please put the answer in the comment box. So let's answer the question, what is TMS? Well, TMS is a brain stimulation. You see, the brain cells communicate with each other either through chemicals or electromagnetic currents. And so TMS is one of the brain stimulation that uses the magnetic resonance like MRI. So you see, our brain cells communicate with each other either through chemicals, we call them neurotransmitters, or electromagnetically, so we call it circuits. And so when we use antidepressants to improve depression, we are using the chemicals to enhance the neurotransmitters that are helpful in improvement of depression. When we use a brain stimulation like TMS, what we are doing is we are creating the electromagnetic field around the area of the brain where the neurons or the brain cells are not functioning well. So by stimulating, we stimulate that brain, and once the cells start working, the person's depression gets better. It's different from ECT. In ECT, we are using electric current to stimulate the brain. In TMS, we are using the magnetic resonance, so it is much better tolerated. When we are using the TMS for depression, we are stimulating the parts of this brain that is involved in depression circuit. And there are other conditions where also TMS is used, like OCD or PTSD. There are more studies being done to study its benefit in case of chronic pain and seizures. So in all these situations, we are using the brain stimulation to stimulate certain parts of the brain that are part of those brain circuits. So the third question comes is, does it really work? Well, there's been studies over last 20, 30 years. It has been approved since 2008 by FDA. And when FDA approves a treatment, it has to show significant response. So the initial studies that got FDA approval showed that people who had tried 1 to 26 antidepressants and were not getting better showed significant response. And the 1 year studies have shown that around 67% of people have significant response, and 45% of the people go in total remission. And total remission means totally depression disappearing. And so it has significant response. I've been doing it for 5 years, and it has many of my patients had significant response, and it gives me real pleasure when I can see that a patient who comes in crying initially is smiling. I had one patient who was a mother of two, and she was so depressed that she was not able to work, she was not able to take her kids out. And once we started doing the TMS, she started getting better. When she started coming to see me first time, she was on 5 antidepressants. When she started getting better, we started gradually going down one by one. And then when she was on the when we were going down on the third medication, she had a relapse. So we gave her a booster TMS and she got better. And then gradually we were able to take her off medications completely. And then she was telling me that how she's enjoying the concert. She's enjoying taking her kids out to the parks. And then she returned to work part-time, and then she returned to work full-time. And she's been doing really great and staying in remission for several years now. I had another patient who was working, but he was having a lot of absences from work because of the severe depression. And then he would start becoming suicidal. And they had tried all kind of medications before his doctors sent the patient to me. And then once we treated him, then he started getting better. And it was such a feeling of satisfaction when one time he brought his dog and he was telling us how he's enjoying his life again and he is enjoying his work again. So yes, in many people it can improve their depression. There are some cases where people may not respond, and that could happen in any treatment. And now, as the research is going on, there are newer technologies, and so we just recently got a newer technology which uses theta burst with the TMS, and we are hoping to be able to treat more patients with reduced time and with efficiency. So the question number 4 comes is who can benefit from TMS, when to use and when not to use. Well, as I was sharing earlier in the stories, that there are different levels of treatment for different severity of condition. So we did a program called Depression Goes Away, and I'll put the link for that video over here, where it would kind of give you more explanation. But briefly, I work on the framework that there are 5 lines of defense against depression. So the first line of defense is prevention. When you don't have depression, you do healthy habits and lifestyle changes that would decrease the chances of depression from occurring or recurring. The second level of defense is developing mind healthy habits, what I call stress to joy mindset. And I've developed many resources on stress to joy that I'm going to put the link also. The third level of defense is psychotherapy. And so psychotherapy generally is called talk therapy. It may sound very simple, but when you are doing this talk therapy, the therapist is helping you identify the hurtful thoughts that are keeping you depressed and making you feel negative. And you can learn to change those negative thoughts into positive, those hurtful thoughts into helpful thoughts. And significant number of people with depression can just get better with just psychotherapy. If the psychotherapy is also not working, then you go to the fourth level, which is the medications. So many medications can help people get better. If some medication is not working or giving side effect and a person has failed more than 2 to 4 antidepressants, then comes the fifth level, which is the advanced treatment, and TMS is one of them. And so it should be used only for people when it is appropriate, but it should be used in the people where it is needed. And like I was saying earlier, the person who needed it was too scared. So we want to overcome that fear and get the help which is available. And if it is not appropriate, there's no sense in pushing for it. You can use the example of diabetes. Like when somebody has diabetes, you don't give insulin to everybody, right? First, you try the lifestyle changes, and if that doesn't work, then you try and you work on diet. And if that doesn't work, you work on medication. And if that doesn't work, then you go on insulin therapy. So similarly, for depression, you try different levels of treatment. So the fourth question comes up, what are the pros and cons? Well, the benefit or pros for the TMS is that it does not require anesthesia. It is non-invasive, so nothing is going in your body, no medication is going in your body, and it is pretty well tolerated. And it's outpatient service. Patients continue normal routine. Like, you go to a dentist office and you can go back to work if they have not pulled your teeth that day. But similarly, a lot of my patients, they come from work, they can go back to work, they can drive, they talk, so they're not being put to sleep, and they could continue their daily functioning right after the treatment. And the other benefit is that it's a good alternative for patients who may have responded to ECT in past. On ECT, because of a higher level of side effects, some people have memory problems, but TMS does not have the memory problem. And what are the cons? Well, some people may have some facial twitching, some eye twitching, or some lip twitching during the treatment. Some people may have a little redness at the area of stimulation. Some people may feel anxious for any new procedure. They may feel anxious, right? There could be mild discomfort, which usually passes after the first treatment. Some people may have headache, which also is mild, and usually using Tylenol or ibuprofen takes care of it. Process of going through insurance coverage can be cumbersome, and that is something like people to go through to be able to get authorized on insurance, and it's a time commitment. So because it requires about 20 to 30 sessions, therefore the person has to come to the office 5 days a week for 4 to 6 weeks. So it's a time commitment, and you only do it if it is necessary. But if, as I said, if it is necessary, then it's better to get it instead of continue to suffer and continue to have depression affect your work and family life and personal life. So how to find if it is right treatment for you? Well, I have developed a little checklist with the PDF or assessing level of depression and the criteria that you need to meet to be able to qualify for TMS. You can get the link to download the TMS checklist by clicking the link in the description, or you can text joyful to the number 38470, and I will send the link where you can get the access to the checklist. So my message to you today is that you don't have to suffer unnecessarily. Depression is a treatable disease. There are many treatments available. As I said, that there are many levels of treatment that you can access. And if you have tried other levels, and if you need this advanced treatment, you can get the treatment. And if you do get the treatment in time, you can get out of depression and live a happy and healthy life. Remember, life will present many challenges and stressors like depression. How you respond to them can make the stress from cause of suffering to an opportunity for growth. Every step that you take will take you from stress to joy. So take a step today. You can do it. Till next time, Dr. Rozina.